The biggest hospital in Louisiana is breaking records. Our Lady of the Lake Regional Medical Center in Baton Rouge has more COVID-19 patients yesterday than it had at any other point in the entire pandemic. 140 patients hospitalized with COVID-19, 50 of them in the intensive care unit. It may be the biggest hospital in Louisiana, but it's not alone in being hit by a new surge in coronavirus patients. Louisiana has the highest new daily case rate per capita of any state in the country. Governor John Bel Edwards held a press conference today in which he was not shy about how bad the situation has gotten or what he thinks is causing it.
We are very unfortunately in a position that we had hoped and we had prayed that we'd work very hard to avoid. But quite simply, the Delta variant is an absolute game changer, superimposed as it is in Louisiana on a state that is not sufficiently vaccinated. As of today, 45 hospitals in Louisiana have requested additional assistance with staffing capacity. Just as a point of reference to sort of show where we are and how quickly the COVID situation has mushroomed, in Baton Rouge right now, there are more people in the hospital with COVID than there was in the entire state just a month ago.
83.7% of the cases across Louisiana right now are from the Delta variant. The governor stressed the importance of getting vaccinated and masking up, not only because of how much faster the Delta variant is spreading, but because of who was spreading it. The number one age group spreading the virus right now in Louisiana is the 18 to 29-year-olds, followed by people under the age of 18. The average age of a hospitalized COVID patient in Louisiana last month was 64. Today, it's been dragged down to 54 years old, and not because of a flood of middle-aged people. Going back to Louisiana's biggest hospital for a second, Our Lady of the Lakes Children's Hospital had 11 children hospitalized with COVID yesterday, 6 of them in the ICU. That is made all the more concerning for Louisiana and the nation by the new revelations from an internal CDC document the Washington Post was first to report on last night, which shows that the Delta variant appears to cause more severe illness than earlier variants and spreads as easily as chickenpox. Maybe most importantly, the CDC presentation said that although vaccines make vaccinated people 8 times less likely to get the Delta variant, if a vaccinated person does get a breakthrough case of the Delta variant, they can spread it as easily as an unvaccinated person. To echo Louisiana's governor, the Delta variant has been an absolute game changer. No one is seeing the impact of that more firsthand than the doctors and nurses in Louisiana right now. Joining us now is Dr. Mark Lapperouse. He's the emergency room medical director for Our Lady of the Lake Hospital in Baton Rouge, Louisiana. Dr. Lapperouse, thanks for joining us tonight after what I can only assume has been a very long day for you and your colleagues. Of the people you are seeing, of the people you are treating, are they mostly unvaccinated? Are any of them vaccinated? Are you seeing breakthrough cases?
Yeah, well, thanks for having me. We're seeing breakthrough cases, but 80% of the patients that are being hospitalized right now are unvaccinated. And as y'all said before, it's a younger group. It's 50% of these are under 50. A third of our patients are in the ICU. These last 2 weeks have been a nightmare. They've been way worse than any 2 weeks combined of the original part of the pandemic. This Delta variant is spinning us out of control.
Obviously, you know this, and your colleagues know this, and state officials know this. Is the public registering this? Are they saying, wow, something's very different? When you're saying that you've got more people hospitalized than at any point in COVID, or that these are the worst 2 weeks in the last 18 months, I'm wondering whether that will trigger people to either take things seriously, maybe mask, or get vaccinated if they haven't done so.
I sure hope so. I'm not seeing it out in public. I still see people filling up restaurants and grocery stores. I'm not seeing the diligence with the masks and the hand hygiene that we were seeing early on when everybody was forced to stay home and they were kind of sneaking out of their house to go to the grocery store. People are being pretty casual out there. The vaccination is absolutely important. But until everybody's vaccinated, we have to be really serious about the mask wearing, about social distancing, about small group settings, about getting back to virtual meetings. This thing is attacking the hospitals right now. And we're the biggest hospital in the state. And if we can't, if we're at capacity, we can't support all the little hospitals around the state in the region that we typically do. So they're holding patients in their emergency departments, which is very uncomfortable for them.
This is a really interesting point, right? In rural America, one of the things is if a hospital is sort of beyond its capacity in being able to treat someone, or there's better treatment at a sort of a fully functional center like your own, typically they will transport the patient to a place like your hospital. But when you're full, that affects other people's lives.
Absolutely. It's called capacity. I said it on the news last night. When a hotel has no vacancies, they have no vacancies. We have no vacancies at the hospital right now. We're at capacity, which means we are not allowed to accept anybody from another hospital. And so we have to say no. That's a sad thing to say when we know some of the resources that they don't have at these facilities. They're critical access. And that's something that we've always prided ourselves on, is to be able to take care of the rest of the state. And right now we're struggling to do so because we can't even take care of our own community.
What do you need? You've requested state and federal help. In what form does that come? You know, through the course of last year, we knew when it was PPE or when it was ventilators that people wanted. What is it that you need now?
Right now, we need people to behave. We need people in the public to behave. We need people to understand that just because you have been exposed to COVID and you might have a mild cough, you don't need to come to the hospital. You don't need to infect a lot of other people along your way. If you can't breathe, obviously we need to see you here. If you're having bad chest pain, we obviously need to see you in the emergency department. If you have severe abdominal pain, absolutely come to the emergency department. Stroke-like symptoms, yes. But if you have something minor, call your doctor, try a virtual visit, do everything you can to stay away from other people, because this thing is extremely contagious. Anybody that you see and come close to is going to get it, and then they're going to give it to someone else, and it's exponential. So we can't control this. It's spinning out of control, as I said. We're seeing so many more cases. We're doubling our hospitalizations each week. So we started off last week with 75. This week we're over 160 now as of today. We're admitting a patient an hour or more with COVID-19. And these are really sick patients. These aren't the ones that are walking around coughing, around our waiting rooms.
The governor stopped short of enacting a mask mandate today. He says he's going to think about it over the weekend. What do you think he should do?
I'm wearing my mask everywhere I go, so I'm leading by that example. I think that the governor's got a tough decision, but I think that everybody should realize that wearing a mask is a simple thing to do. It's a courteous thing to do. This is now definitely, people should feel this as the pandemic. Before, we were scared. We didn't really know what was going on last March and April. Now we see what's happening in front of our eyes. These numbers aren't lying. The masks are something very simple that you can do. And take your mask, put it on, and go to the nearest vaccination center.